Okay, so it's really very sad that the NMA Cross River State is going on an indefinite strike to put the lives of Cross Riverians at risk for upload of results or no upload of results. First and foremost, we were not informed about any of this. They said they are an independent center, and they went ahead to send samples, which we do not know if they sent or they didn't send. We don't know anything about it. The claim is that samples was sent to Ebonyi State, and that they got results back from Ebonyi State. As a state, we do not have powers over Ebonyi State to announce anything from Ebonyi State or stuff like that. If we are brought into the picture, we don't mind if you're the one taking samples or if you're the one sending samples. But if you're brought into a picture, they are written public health procedures and responses that should take place for a sample to be verified and then, of course, moved from one point to the other, being transparent. There are verified principles that you must follow. Number one, you should be able to at least identify who the patient is. Secondly, you do a history taking, and then, of course, you write it down in the case finding forms. And then after that, you fill all the required forms. And if the person meets the criteria according to what NCDC have written, then you take samples, you issue to the person an ID number and then an EPIC number, and then you send the samples in a perfect situation. Of course, the jokester box and all what is needed, the sample collection kits full, and then you send it to the lab where you can trust the integrity of that sample. The sample gets tested, and then the results are brought back, and then the results are uploaded. This is the normal public health response and procedure anywhere in the world. So I don't know why they would not want to go through that procedure, and then you declare a strike in the name of they did not upload your results. That's the reason to kill people in their numbers. That's the reason to...
Just one moment, doctor. I don't know if you would agree that they have genuine concern, because according to a statement from the chief medical director of the University of Calabar Teaching Hospital, they said that those 5 samples returned positive and that they have duly informed the Cross River State government and other agencies of government. Are you saying you're not aware of this?
Okay, so up until this minute, no information was given to us except for a call by the CMD to myself, who said that 5 samples that they sent. We said, when did they send it, who, and all of that. We're not given that information. They said 5 samples that they sent returned positive. We said, okay, fine, great. Can we have this? And then we're transferred names of 5 people, no phone number, no contact, nothing. I even spoke with the CMAC. I said, can we get at least the contact of this person so that at least we verify who they are, and then we can carry on with contact tracing while every other issue that should have followed a public health response is being sorted out. Every day in Cross River, we go on radio, we go on TV to announce to our people. I went through over 30 churches yesterday announcing that we have a testing center at the Lawrence Henshaw Memorial Hospital, which has been accredited by NCDC. You can come in and get tested